Hi, this is Dr. Inky Parrack again from Sarasota Vascular Specialists to talk about stroke. Stroke is such a big and scary topic, and we're going to delve a little bit and pick it apart so that it becomes a little bit more tangible for you. Stroke, in the big essence of terms, is basically lack of blood flow to some part of your brain, and that brain function then diminishes and dies. When you get an MRI of the brain, you can see a portion of your brain tissue that has completely died and it does not come back alive. And that's the definition of a true stroke. A small portion has died, and the causes of that death comes from many different things. So one, it could be that a small piece of clot had dislodged and come from the heart from things like atrial fibrillation, and then it went to the brain and lodged itself somewhere, killing that specific part of the brain tissue. Or it could be that some portion of your carotid artery, which is the big artery that feeds the brain, one on the right and one on the left, and that could have either crumbled some of the plaque, or the plaque, as it crumbles, a clot forms around it to try to fix itself, and that mass then goes into the brain and causes basically lack of blood flow to that side, and that causes tissue death, leading to stroke. So let's talk about the things that we are more familiar with and most people refer to as stroke. In vascular surgery, it's called ischemic stroke. The two big components to think about when it comes to stroke is prevention and treatment. And I think where people get most confused and has a difficult time grasping, people think that once they have a stroke and we're able to go in and do a surgery for it, that their symptoms that they are suffering from is going to then reverse itself. I would say about 99% of the time, this is not true. Stroke is, like we talked about, a death of portion of the brain. And so if a part of the brain dies, no matter how much blood flow it goes into that area afterwards, completely dead tissue does not come back alive. The surgeries do two things. One, it provides blood flow to the remainder of the brain tissue, allowing your brain to then take over some of the function. You've heard of the saying that we only use a very small portion of our brain, and it's true. A lot of people do not have, only one center that can do one specific function. So if you lose a lot of the language because that language center has diminished, your surrounding areas, as long as it's well perfused, then take over and then be able to, your brain to relearn some of the things that it has lost so that you can talk again. Or in some people, their English goes before their French, and you can come back learning all of these languages coming back within the next months to come. And two, it has to be that you don't have another major stroke, which then you may not have enough brain tissue left in order to do what you need to do. So that's where the stroke surgical management comes in. Either sometimes when you have an acute stroke, you may have to go into the hospital, and we may have to go in and suck out some of the clot that is there. And we work hand in hand in conjunction with interventionalists, the interventional neurologists, as well as the medical neurologists, in order to get you this acute blood flow issue addressed. At the same time, once that acute issue has been addressed, within what is recommended is within first 2 to 2 weeks, that 2 days to 2 weeks is a time frame where you come in and address the carotid artery disease or the issue that is in place, such as going in and cleaning out the plaque in the carotid arteries so that you have now adequate blood flow to the remainder of your brain tissue, as well as prevention of any more of this crumbling of atherosclerotic plaque, which then can go and hurt your brain. And once that's accomplished, then there is prevention of another second event, which then may be devastating for you. I think when people talk about carotid surgery, they mistakenly think that it is end all and be all in terms of what needs to be done to make stroke better. Yes, it does help in terms of improvement of symptoms, but it is not making your brain tissue come back alive. And two, the major key component is preventing another major stroke from happening, which your risk of another major stroke within the first 3 months is exponentially higher if you had a stroke or a mini stroke in the beginning. The other things that I get asked is, my carotid artery is very blocked, and doc, you're recommending me that I get a preventative surgery to go in and clean it out. Well, now I go from from 80% blockage, you're going to go in there and clean this out and come up with 0% blockage. Am I going to be smarter? Or a lot of people say, my memory is just not good. Am I going to be able to remember a lot more things now? The textbook answer is no. However, this is where it's very controversial within the recent sciences. The reason why we traditionally say, and the textbook answer is no, you will not become smarter, you will not have better memory, is because what we're doing is creating a channel so that there's no more little specks or crumbles that can then go to your brain and cause a major stroke. So you can imagine it's not necessarily your brain is becoming better, it's that we're preventing your brain becoming worse, right? So that's what the surgery is technically doing. And so we would say that no, it's not going to make you smarter, it's not going to make you remember better. However, very interestingly, more and more advances in medicine have come about, and more studies have come about, and it has been the carotid artery stenosis is being more associated with higher risk of dementia as we age. So how is this possible? Do we really have lack of brain blood flow from these stenoses that we have to get a better blood flow by all means, even at 30%, 40%, 50% in order to prevent dementia? The science behind it, as far as we know so far, is not necessarily that. We have 4 different blood vessels that go to the brain, the 2 vertebrals and 2 carotids. So one goes, meaning 100% blockage in one. Most people do okay, and there's plenty of blood flow to the brain, and there's really no issue in terms of being starved for the blood flow. However, what can happen as you start to have disease, that is, even though there's not an outright stroke, is you can have tiny little flecks that crumble and go to the brain, and it doesn't necessarily hit the major areas that cause deficits like vision loss or, complete drooping of the face or one side becoming weak, but it hits tiny little centers that help you be that more sharp and retain a memory and not going down the pathway of dementia. There are more and more evidence with respect to this, and some of the things that we see is within MRI. There's something called DWMRI, which are tiny little flecks you can see on diffusion weighted imaging, that there are tiny little white dots, which represents some areas of ischemia, but it is not clinically relevant. You're not going to wake up one day and say, I can't move my leg, but slowly over time, all of these things can accumulate to have increased dementia. The science is not perfect, and we have not figured everything out yet, but it is coming and it is moving forward. So for now, the carotid artery prevention and treatment comes down to reopening your carotid arteries and preventing as much as possible some of this flaking that can happen from the carotid artery atherosclerotic plaque and going to the brain. It will help you for sure with stroke prevention, and it may help you to prevent some of the dementia that progresses. But we will have a little bit more data as it comes out, and at that point, we'll then further update you on any interesting topics on this. So this was Dr. Inky Parrack talking about carotid artery disease and stroke.